If you're returning to running after having a baby or after a long break, a common question you might be asking yourself is, am I strong enough? Which is a great question to ask, but strength actually only tells part of the story. So when you are running, there's actually a flight phase where both of your feet are off of the ground. And when that happens, one leg has to buffer the impact, sustain the load, transfer it to your pelvis. Then your pelvis and your core have to coordinate together to make sure you stay stable and are able to advance the other leg. So that is why symptoms often don't come up when you're walking, especially if you're doing like really fast walking. You think you're all ready. What's the difference? And then when you start running, you add the flight phase and you start to have some symptoms. That is why we look at single leg stance activities in our clinic, both static single leg stance activities as well as dynamic or moving activities on one leg. That way we can see not just strength, but how well you're able to coordinate, how well you're able to absorb impact, and how well you're able to sustain a load over time. Which brings me to the next thing we take a look at, which is endurance. So, are you able to participate in 20 minutes of walking? Are you able to participate in a 20-minute low impact aerobic program? And when you're doing that, are you able to breathe? Can you use your diaphragm properly? Are your ribs expanding well? Are you keeping semi-upright posture, or are you starting to use all these compensatory strategies? Those can show up later on when you're running. Running is repetitive and it is sub-maximal. And some of those fatigue factors and compensatory mechanisms, they don't show up right away, but they show up when fatigue sets in. And that's what's going to set you up for more symptoms and more injury. The other thing we take a look at is, how do you feel during the exercise? And then how do you feel after? I'm a pelvic floor therapist, so some things I specifically ask are, do you have lower back pain? Are you having even lower sacroiliac pain or pelvic girdle pain? Do you feel heaviness in your pelvis during or after exercise? Or do you just feel like you're not as held and supported as you once were when you were running previously, if you had been running previously? So those are some of the things that we take a look at. And then if you're noticing like, oh yeah, I do feel some of those things, you can call on your friendly neighborhood physical therapist. We can create a really inclusive program just for you and how your body's acting. And we will test strength because that is important too. It's just not the only thing that we look at. My name is Jessica Lockett. I'm the owner of Pathway Physical Therapy and Wellness in Boca Raton, Florida, where we are here to help you find your way forward.